Hi, I'm Eugene Mayor Lucy Vinis. Thank you for giving me an opportunity to share a few thoughts with you about the partnership between the City of Eugene and Crisis Assistance Helping Out on the Streets, or Cahoots. We are proud of this long partnership and encouraged by the number of cities across the country that are interested in replicating a similar model. And I have a special note of thanks to Senator Ron Wyden, who is speaking tomorrow, for his leadership in strengthening and funding this kind of program. I will focus on three aspects of this 31-year partnership: its value to the community, the shifting landscape in which we are now functioning, and how the services of Cahoots relate to the larger system of services in our community. Cahoots is a product of creative problem solving. It was an out-of-the-box idea by folks who recognized that for people in the midst of a mental health crisis, the arrival of an armed, uniformed officer can worsen their emotional state rather than resolve it. Since 1989, the City of Eugene has benefited from this gentler and more appropriate response to specific needs in our community. The people in crisis are treated as patients, not criminals. The police are supported by the presence of Cahoots or freed up by the Cahoots teams to respond to other calls. And the community as a whole feels that care and protection is being offered by the right person with the right skills for each incident. This partnership is embedded in our civic culture because it emerged out of recognition and respect between a nonprofit health provider and the police. It gives us the agility to respond appropriately. In 2019, Cahoots responded to 13% of all police calls. Annually, Cahoots has been the sole response in about 5 to 8% of calls for help. The value of this program has only grown. We are living in a time when more people are struggling with untreated mental health and substance abuse issues, and more people are falling into poverty and homelessness. We have more people than ever before who are on our streets with nowhere to go and no resources. While Cahoots is not solely directed towards serving people who are unsheltered, the steady increase in this vulnerable population has contributed to an enormous increase in the calls for a Cahoots response. Pre-pandemic, the number of calls doubled between 2014 and 2019. In response to the killing of George Floyd and subsequent racial justice protests, Cahoots is held up as a model in response to demands for police reform. This stems from the acknowledgement that Black, Indigenous, and people of color in our community, those members are historically and disproportionately victims of over-policing of minor incidents, and conversely will benefit from improved de-escalation tactics and responses. Both of those shifts in our public landscape, the increase in homelessness and heightened awareness of the need for de-escalation, not only point to the value of Cahoots, but also direct our attention to our larger system of services. Cahoots is an emergency response. It is how we choose to best serve people on their worst day, in their worst moments. By far, the majority of the calls to which Cahoots respond are welfare checks, assistance for crisis counseling, or transport to the hospital or other services. They are integral and essential component of our constellation of services, and their effectiveness is tied to other services that are available to help people recover, whether that is hospital care, emergency shelter, or ongoing mental health counseling. The partnership that begins with our public safety system, specifically our police department, continues with those social services and medical providers. As I said in the beginning of my remarks, Cahoots has a specific and unique history rooted in Eugene. The model of care is replicable. The structure of that model may vary, determined by the strength of your nonprofit provider network and considerations about whether this service should live within a public agency or in that private nonprofit health sector. The foundation of success is built in adequate support and respect, in that close partnership across the spectrum of services. People must believe in the value of this program in order for it to work. It requires investment and a clear understanding of the respective strengths of law enforcement and behavioral health providers. After 31 years, our partnership is still evolving. In closing, I will say that however you choose to implement a Cahoots-style program, I applaud your efforts and consideration of this model. Everyone in our community deserves appropriate care and respect for their mental health needs. And police officers deserve the expert support in responding to those needs. We all benefit. Thank you for giving me time to share our experience.